I'll kick us off with a brief introduction, just a little bit about how IDB and Pan American Health Organization are working together to support connected health for all. And then I'll pass it over to Carlos to talk in more detail about some of our exciting projects that we're working with countries in the region. Sound good?
Just go ahead. Yes, thank you.
All right, perfect. Thanks so much, everyone. And sorry that we can't be there with you in person. I'm sure it would be much more enjoyable, but happy that we can connect virtually today. So I just briefly wanted to talk a little bit about what is the Inter-American Development Bank and why we're working in digital health as one of our strategic areas. The Inter-American Development Bank is the leading development bank for financing and technical assistance for the region of Latin America and the Caribbean. One of our main priorities is the health sector, and we know that to do a good job in the health sector, working with our member countries as far as increasing quality of care, increasing efficiencies, and also improving population health, it's an information-intensive endeavor. Therefore, digital health has become a strategic part of our strategy in addressing health within the region. And specifically for digital health, our mission is to harness digital tools to improve the efficiency, quality, and equity of the health sector. And there we have four main lines of work. And the IDB has actually taken in 2017, we actually took a really hard look at the way we were looking at digital health. It wasn't a new investment for us, either across our public, private, or entrepreneur arms. But we decided that we really wanted to get intentional about the way we were approaching investments in digital health. And therefore, we formed a team of experts within the IDB that I lead. And these are the four lines of work that we focus on. So first is, of course, supporting quality design, execution, and evaluation of both national digital health agendas and operations that we may be supporting for digital transformation in health. We also have a line looking at increasing human capital in the region for digital transformation. A big part of our work is supporting strategic alliances, both inside and outside of the IDB for digital transformation. And what that might mean is, just like I lead our digital health practice within the IDB, we also have a digital government practice. So we work very closely with them for things like some of the things that our other presenters talked about today, like cybersecurity, digital ID, things like that. And also outside of the bank, for example, our work with PAHO, WHO, we learn a ton from the Global Digital Health Partnership, and of course the other countries represented in this panel and some of the other networks that we'll hear about shortly. And of course, all of you all, as technical leaders from IHE, we've learned a lot about the way IHE has approached interoperability and from the countries that participate and use the standard. And we'll talk a little bit about that in a minute. And then lastly, just to generate and disseminate knowledge for the digital health transformation of services within LAC. So we also want to make sure there's a big deficit, in our opinion, not just our opinion, that we can find in the global literature looking at evidence specifically in the Latin American and the Caribbean region. So we invest as well to ensure that we can learn from what's going well, what needs to be improved as far as investment in digital health. So we recently published, well, in 2022, April, we published our flagship, which was looking at the golden opportunity of digital health for our region. And within that, it really summarizes our approach, the business case, we think, for investment in digital health, and also looking at different tools and approaches technical tools and approaches that IDB and other groups have put out towards advancing this agenda. And we use the analogy of a digital house, inspired by some previous ISO work and adapted to our region to talk about the importance of adequate digital health foundations. And I'm sure I don't have to talk to this group about the importance of balanced investments and actions and results in these 6 areas, but this is a framework that's been very powerful for us and countries as well, as we work together to think about planning their investments and their national digital health strategies, that we've got actions, investments, and results in each one of these dimensions. And I think today what we're going to focus on more is really some of the work that we're going to see in governance and management related to clear regulatory and standards framework and digital architecture and data governance, and also for infrastructure for obvious reasons. And I just really wanted to quickly talk a little bit about the infrastructure dimension of the house. And in our analogy, of course, I'm sure no surprise to this group, when we think about the house analogy, being able to turn on your water and make sure that the hot and cold water is running to the right place, that you don't have a toilet in your kitchen, and that your electricity is all working, is an analogy that we find works very, very well for everything that we need to have an adequate and a strong infrastructure. And this, I would say, is probably one of the Achilles tendons that we have and still have in our region, and one of the areas we've been working very intentionally towards. So starting on the right, some of our work has really focused on working with different SDOs. For example, here we were supporting different countries. In this case, it was El Salvador to consider joining SNOMED, for example, as part of their work. So here is where they were welcomed into the SEO. Here we supported various national connectathons between public and private sectors to support health information exchange. In this case, in Colombia was also kind enough to invite the Roxel countries from Roxel to come and also observe their connectathons so they could learn from that experience. And various other countries have been asking for us to support connectathons nationally within their jurisdiction. And together, this one was also done as well in support with the Pan American Health Organization and the Ministry of Health. In the middle group here, and I'm not going to talk too much about this because Carlos is really going to go into a deep dive on this, but the Inter-American Development has also been supporting since 2013 the Roxel network, which is a network, again, of countries for information exchange and learning, really focused on interoperability. And the first phase of the network was really focused on issuing guidelines and learning from different policies and architectures and different standards recommendations. But the second phase was really focused on getting our hands dirty, which is where the LACPASS Connectathon comes into play, which was, I'm not going to talk too much about it again because Carlos is gonna speak about it momentarily, but we're really excited about this initiative and excited that we'll actually be expanding. We were able to finance some additional projects, not just focusing on vaccine and IPS, but Carlos will also talk about that in a minute. So again, just to summarize, a lot of a focus on national level investments, a strong investment and focus on learning at the regional level, and then also, as I mentioned, generating evidence. So we're currently working on a survey for health information exchange centers because we'd like to learn a little bit about what has been the experience at the national level, regional level, and global level to support health information exchange. Everything from, what's the business model to make these different centers sustainable? What are the different services that are most valued by countries and the other members of the ecosystem? So I know that I'm sure various people who are in the audience have actively participated in this work. Also, a shout out to Jürgen for his expert support in this study. And we're hoping that this will be something useful not only to our region, but also globally to share a little bit about what we've observed and learned from you all as far as best practices and lessons learned about health information exchange centers, in addition to other types of reference material that we have related to interoperability. And I just wanted to close, and hopefully the technology will work with me, and I wanted to show this really short video from our leadership of where we think that this is going next. And as I mentioned, we've been working with countries to support cross-border interoperability, and Carlos is going to talk about that. But this July, we had a meeting between our president, President Ilian Goldfein, and the PAHO director, Harvard Barbosa, and we came together to celebrate 5 years of collaborative work together, but we also issued a call for action for the Pan American Highway for Digital Health. And I just wanted to show you guys quickly this very short video, and hopefully you'll be able to hear let me just make sure you guys can hear the video. If not, we can at least see the screen.
Estamos aqui no esforço conjunto.
Can you hear it?
Todas as pessoas na América
Yes, we hear.
devem ter acesso à assistência médica, aos serviços de saúde, não importa onde esteja. Imagina se você é do Chile, mas fica doente em outro país, por exemplo, em Belize. Você deveria poder ligar para o seu médico no Brasil ou no Chile, em qualquer lugar, e ter a prescrição médica em Belize. É disso que se trata uma assistência médica regional, que garanta o direito à saúde a todas as pessoas da região. É isso aí, uma estrada pan-americana de saúde digital, que coloca o sistema de saúde das Américas juntos. Vamos fazer isso, Carlos? Vamos sim.
So Thank you guys for that. And without further ado, I'm going to pass the floor to Carlos so he can talk a little bit more about how we've been preparing for our Pan-American Highway for Digital Health and our progress so far. Thanks so much.
Thanks, Jenny. I'm going to share my screen. A minute. Okay. I'm going to deep dive and about the LACPASS initiative, the LACPASS experience in the execution of this project until now. The first thing that I have to mention is that the LACPASS project is a regional public good. The name of this RPG is Digital Transformation in Health to mitigate the effects of COVID-19 in Latin America and the Caribbean. And the LACPASS is a short name for this project, where we have until now 14 countries formally participating on this project, and really they are the main actors of the regional public good. That is sponsored by IDB, of course, aligned with PAHO and WHO in terms of strategy and standards, implemented by SENS and in collaboration with RACCEL. This is the Latin American Caribbean Network for cooperation on digital health, PAHO and HL7. The main objective of the regional public good is to strengthen the capacity of the countries in LAC to address the effect of COVID-19 by promoting digital transformation in healthcare. The regional public good has a 3-year time window. Last year and for every year we have defined one component or phase or stage of the project. Last year, we was working on higher levels of interoperability for exchange of clinical care data. We was working over there with the AUDCC COVID certificate. That was the proof of concept that we worked over there. This year, we are working in data exchange for epidemiological surveillance and public health at national and regional level. And next year, we will be working on create guidelines and directives for the sustainable development of telehealth on the region. In general terms, the LACPASS project and the RACCEL network also is working on trying to reduce the gaps on the countries of Latin America and the Caribbean for digital health, doing a lot of knowledge dissemination, working with the standards and doing a lot of testing, trying to have our proof of concepts with interoperability profiles. Developing some enablers for an easy adoption and understanding of the standards in the region. And of course, a lot of networks, cooperation, trying to do a lot of synergy between the technical teams of the ministries of health of the different countries, and a lot of capacity building over there. The history until now, a little bit of history of this project. We kick off this project, we start in May of 2021. We start with 6 countries. And of course, from the day one, we start to look at the experts, look for international experience and try to bring that knowledge over here to the region and try to disseminate this knowledge. We try to do a lot of development, try to deliver some libraries and technical tools to the countries, to the ministries of health for an easy adoption, an easy understand of the profiles, integration profiles and standards. More countries start to join to this initiative, and we start with the trainings and the proof of concepts. Really, the 3 pillars where we are working on are knowledge dissemination, development for an easy adoption, and training. We really believe in the learning by doing. This is it really helps to the countries, and it's working for us to try to learn by doing, do a lot of testing, proof of concept. And we in between May and June of 2022, we finished with the first part of the project with this with our first LACPASS Connectathon, working with IHE. It was a fundamental part of the project, have this first Connectathon. 8 countries participate on this. I have some highlights from that experience. Last year we was talking about some of the result of this first LACPASS Connectathon. From there, we start to work more near with Bajo and find that some of the resources could be used in a better way. So the convergence of cross-border interoperability initiative for the region born over there. We do a measurement of the level of maturity for development and implementation of digital certificate for various of the countries of the region, with Bajo, of course. And we continue our work with more knowledge dissemination, more development of enablers and trainers, and training with the Ministries of Health, and more countries, of course, join to the initiative. And now we are preparing for have our second Connectathon. This will be on November. We will be testing other profiles. I will mention on a few slides what are the tracks of this Connectathon, and of course working with IHE again in this second LACPASS Connectathon for the Ministries of Health of the countries of the region. Every material resource and knowledge, every product by product that we have from the LACPASS project is available for the community. That's the idea. That's the spirit of the regional public good. Is the spirit of Raxel Network too. So we have some platforms available over there with a lot of information and libraries. For example, we have all the documents is available on the Raxel website. We have a document repository over there with technical guidelines. We have a Moodle learning platform available too. We have our own YouTube channel with all the recordings of the webinars and workshops and everything that we are working on the project. This year we work on our own implementation guide for the IPS. This is the guide that we are going to use for our second Connectathon. We have our IPS LACPASS. And of course, a lot of libraries and source code available on GitHub. We are working this year with Docker package for the easy adoption of the countries. And our test platform for the Connectathons is, of course, IHE Gazelle, and we are working really hard with the technical team from IHE Catalyst preparing our second Connectathon. From the learning from the first Connectathon here in the region was really important for us, because for the first time in this part of the world, in this part of the continent, 8 countries demonstrate that cross-border interoperability in health is possible. In fact, 5 of these 8 countries that participate on that event achieve the EUDCC equivalence in productive environment. And various of the countries are reusing some of the project components for national Connectathons, and even for some of learning and as a base for their own digital strategies in health. So we hope to have this for the second Connectathon. We hope to achieve a much more higher results. Where are we heading now? What are things that we want to do? We have defined a technical route based on the IPS. The International Patient Summary is the objective on this part, on the test that we want to do. And from the IPS, we want to build the other byproducts that we will be testing too. For example, our idea is to use the IPS, the immunization of the IPS data for build the DDCC, the COVID certificate, according to the WHO standard, and try to do some experimental tests over there with other non-COVID vaccines too. So from the 12th to the 14th of November of this year, we will be having this second Connectathon on Sao Paulo, Brazil. This is a really it's a joint event. It's part of a more bigger event that we will be having over there with PAHO, with the Relaxis strategy. And of course, we will have IHE working on Sao Paulo on this event. Until today, we have, I think, 15 countries already registered or in registration process. And of course, the invitation is open for other networks and other countries that would like to participate in the 2 tracks that we have defined for this event. The main one, of course, is the IPS. We have been really working hard in the International Patient Summary for this year on the project. We will be testing the valid IPS according to our implementation guide and some of the MHD transaction for search, for query and retrieve the IPS from other nodes on the region. And the second track is about vaccination certificate. We are evolving from AUDCC to WHO DDCC standard, but we really want to which the standard we want to test some non-COVID vaccine. We have a white list over here for measles, polio, and yellow fever. The idea is to use the standard, stress the DDCC standard, and try to see how it works with non-COVID vaccines. So it's really experimental, but it's part of the test that we want to do this year. And we have an optional part for this track too, related to use DIDs and other and wallets and other blockchain tools for the COVID and not COVID the vaccination certificates. Basically, we will some of the milestones that we want to verify on the Connectathon in a little more of detail. We have defined an onboard process for the countries. And it's really important that every country has their own local node published on the internet. The idea is to share the information between all the nodes through Gazelle, of course, through Gazelle proxy. But that's part is an essential part of a required technical part for this Connectathon. For the track 1, we want to test 3 of the MHD transaction. Remember that we are in a learning process. We have it's really diverse, the maturity of in digital health for every country. So we try to set a line that everyone could achieve. That's why we took 3 of the 80 transaction from the MHD profile. We want to test the 65 for save the IPS in the local nodes, the 67 for search on the network, and the 68 for retrieve other IPS from other countries. That will be the first track of the Connectathon. And the second one is related to the DDCC and DDBC, the vaccination certificate. We have an onboard process over there to define related to the share of the keys. And we will be testing each ones of the certificates and the verification in no peer and peer-to-peer test. The wallet part is an optional, but it's over there too. We want to test, do some tests over there with the vaccination certificates too. So all the work that we are trying to do from Raxel network and in the LACPASS project is aiming to achieve the Pan-American Highway for digital health. Is really a mid and long-term strategy that we have defined with the countries of the region. We already have in progress the LACPASS project, and we will have next year the work around the third stage on the telehealth for the region. We will continue with support the countries to prepare to join the WHO Global Digital Health Certification Network. This is why we are working hard in the track 2 with DDCC certificates. And of course, we will continue to support the adoption of standards and terminologies within the Ministries of Health. We have some components of terminological services available for the countries, but it's more for learning process than for a track right now on the defined Connectathon. And we will be working on 2 new regional public good. The first one is for the development of secondary data use space for the region, and LAC Digital Health Trust Network. Raxel is really a partner here with LACChain in this regional public good. So everyone is invited, of course, from other networks and countries for our second Connectathon. You can contact to us, and I think that's everything that we have to show you today about LACPASS. Thanks.
Thank you very much.